How does bias present itself? I assume it presents itself through the data. And then what are we doing about bias? How do we prevent bias?
Uh, I mean, Mike pointed this out. Like the EMR data is biased because it's biased towards billing for the most part, and unfortunately, a lot of the data is not clean. You've seen the burdens of documentation. Stuff gets copied and pasted. Stuff is like, we know that this billing code applies and the patient is sort of has this, but like the number of times, I'm sure you've had this as a patient where, someone is reading something back to you and saying, is this correct? And you're like, no. The one that always gets me is when they read the medication list and like, are you still taking amoxicillin? Well, of course not. That's a 7-day course. So, the data is missing a lot of information. It's missing what happened really with the patient. It's missing what's happening with the patient in their daily life, which is those activities of daily living are the things that really affect your health. It may also be missing the opinions of the full care team. So, who has actually done the documentation in the EMR? And, I was thinking back, we don't know how it does it, but it does it. Think about like when you see doctors, especially new residents are told, if a nurse thinks something is wrong, believe that nurse. So, is that, that hunch that a nurse had that a patient is about to code or something like that, is that in there too? So when we're looking at, we'll look at patient, when we're looking at patient data, is it the full spectrum of what's happening with that patient?